Hi, my name is Rod Warner. I don't usually make these videos or post things to the internet, but recently I've had an interesting experience being hospitalized with Legionnaire's disease, something that I hadn't even heard of since the 80s or 70s, and I didn't think it was a problem. In this day and age of COVID, I figured that's the big problem everybody has to worry about. Anyway, apparently this is Legionnaire's disease is somewhat similar. It's a very virulent form of pneumonia that fills your lungs up. In my case, it got one side. I guess my right side was totally full of fluid, and my left side was a quarter full, and it was pretty serious. Of course, I don't remember any of this. My memory of how I got the disease, or how I think I got it, was just I was doing what I do. I have a small distillery here in Cape Junction, Oregon, and I was grinding up some pears to make some pear brandy, a pretty popular drink. It was the first batch of the season. We'd had sort of a lot of hot weather this past summer, and the hose had been laying out. I ran water through it trying to clean the hose out before I did anything, and then I hooked it up to my grinder where I grind up the pears. And at any rate, one of the pears I threw in, and it totally exploded in my face and got in my hair. I remember going in the house laughing about it. I know the date because it was on the jug of juice that I extracted that day. It was September 3rd. So at any rate, the 4th, I think, was Labor Day, and we had a party here, and everything was fine. And then everything was fine till about the 8th of September, when I felt kind of, a little off. I didn't have much of an appetite. I still went ahead and worked that day, taking care of people in the tasting room and so on. But at any rate, I didn't feel that good. And then Friday, the next day, unless some customer came, I just stayed in bed the whole day. And at any rate, didn't feel too good. But I didn't have any respiratory symptoms. I didn't have a runny nose, or I wasn't coughing, or I didn't even have a sore throat. I had no idea my lungs were filling up with fluid. At any rate, at one point, maybe it was Saturday or Sunday night, my wife called the ambulance because I apparently had passed out watching TV. And but I didn't want to go. I'm kind of a cheapskate, and I didn't want to pay the money for the ambulance to take me there. And besides, by the time they got there, I seemed to be okay. But we agreed we'd check out, go to the clinic on Monday and see if I had COVID. So we went there and got the little sticks to stick up your nose, and it didn't turn black. We didn't have COVID, and we took some extra ones home, and we both tested again. Neither of us had COVID. And then I don't remember anything after that, frankly, until I woke up in the hospital. We'll have to have an interview with my wife. She knows all the details, but apparently I went there in the emergency, and they wouldn't register any oxygen, and they took me to the emergency and put me right in with a therapy of some sort. I guess I was on an oxygen mask for a while. I don't remember that whatsoever. All I remember, I don't remember checking in. I don't remember anything to speak of, except really strange deja vu experiences and kind of weird dreams, I guess I must have had, although it seemed like I was awake. But apparently the oxygen mask wasn't good enough. They had to put a ventilator down me, and that's pretty intrusive, so they gave me fentanyl, a very strong drug, which apparently gives you deja vu experiences. Other people have experienced this as well. But at any rate, these were almost comical. Some of my experiences, it seemed like it was downhill into the nurses' station, and they were down in the pit, and there was these kind of weird lights coming down from the ceiling that weren't standard lights, and they were doing strange things in that room. It kind of scared me. At one point, I guess I heard Kathy saying, "Breathe in through your nose and out through your mouth." So I was really trying to do that, and I don't know. And then I thought they had me hooked up with all these other patients that were all females down in the nurses' room, and they were like had vines coming out of them or twisting around them, and somehow I was hooked to that through all these IVs and stuff that they had in me, and I remember doing breath counts and being real careful not to have any negative thoughts. I had to think really positive things, or they would swallow me up. This evilness coming out of these women that they'd hooked me up to. I mean, it was really a strange feeling. Then at another point, I thought there was another man in the room with me. Apparently, the room was just had just a single bed, but I thought there was another bed beside me, and I was talking to him, and he was a Native American, and I thought, it was he had a portrait on the wall or something of him. But at any rate, he went down, and he in our conversation, he said, "Well, after tonight, one of us will be here and one of us won't." And then there was a lot of chanting and stuff going down in the nurses' area. I guess I thought, well, I guess this is really a good hospital because they allow for the Native Americans to do their healing as well. And so I remember that, and I thought, Kathy wasn't there, and I was sort of anxious about her not being there, but then I thought, well, they wouldn't let her in. It's night. They wouldn't let her in. So she's down with the Indians. So I thought she was down with the Indians chanting. I was really positive of that. And then I had this weird hallucination that my cousin had been in the Medford Asante hospital, and they had he'd gone in there for plastic surgery before COVID, and somehow he died in there, some second cousin of mine or something, and they had saved his body parts, and since it was compatible with me, they had amputated my feet and put his lower leg bone on there. It was kind of weird. I had this weird thing about feet being amputated, I guess because I couldn't move them or something. At any rate, a few days later, they took me took me upstairs. I guess I was recovered enough they didn't need the ventilator anymore. And the first night there, I thought there was a really big party in the nurses' station. I heard bottles clanking and stuff, and even the next morning, I thought there were like 5 bottles in my trash thing. I remember thinking that I was seeing them, and the whole thing was kind of bizarre. And I remember talking to nurses, and they didn't deny it or anything, but it was kind of, they probably knew I was just crazy on the coming down from the drugs. But at any rate, it really affects one's mind to be on fentanyl for 11 days or whatever, 12 days or more. I don't know how long they had me on that, but even when I came home on October 4th, there was, I like to do my daily solitaire challenge. There's like 5 of them. I couldn't even do the easy one. It was terrible. This month I've done all except for one, and the month's almost over. I solved everything. So my mind has come back, but initially it was a problem. And they actually told me in the hospital it was my body was beginning to shut down, and it had was starting to affect my brain and other major organs. So they had a great physical therapist come out here for about a month and work with me, so walking and swallowing and so forth, and so I feel like I'm almost totally recovered now. I lost 20 pounds while I was in the hospital because I had nothing to eat. They just tube fed me through my nose, and kind of cold mush. and it was not very appetizing. I had nothing to drink. I really wanted a Diet Pepsi, and so the nurse was nice enough. I don't know if she took it out of her own pocket or not, but she gave me a can of Pepsi when they checked me out. Of course, it didn't taste very good after a month not having it. It tasted kind of foul, actually. But now I'm back to it, and I like it fine again. So anyway, it was a very interesting experience. It showed me what's really important in life, which is family, and being just being at peace with yourself and living your life one day at a time. You never know. I mean, this is kind of like being struck by lightning. I was a pretty healthy specimen before this happened, and I'm getting back there again. But it's I guess that's the lesson. You should really live your life each day at a time, and really love the people around you, and appreciate their kindness and help. Okay, well, I'm here with my lovely wife, Kathy.
Hi.
And I think she knows more about my illness than I do, since I was semi-conscious or delirious or whatever during much of it. So I thought I would ask her a few questions, and
Okay.
She could answer for us.
Okay.
So, what was your perspective? When did you feel like I was getting sick?
Well, it started on that Thursday when you wanted to take a nap, and you never take naps.
Right.
And you didn't have any energy, and then you didn't want any dinner. And then Friday you didn't want any breakfast, and you didn't want any lunch, and you didn't want any dinner, and you had a fever, and you slept a lot, and then you started getting really sick on Saturday and Sunday with sort of bubbly sounding, sleeping at night, and not seeming to be too aware of what was going on, even though you kept saying, I'm fine.
Yeah.
But you weren't. So you basically collapsed on Sunday night, and I was calling the paramedics, trying to get them here. They responded great. They were wonderful. But you didn't even realize that you passed out, and it was your blood pressure had dropped too low. And in our ignorance, thinking it was COVID breakthrough or something like that, I was making sure you had all your blood pressure medicine, and your body wasn't capable of handling that medicine, basically. We didn't know it. So the paramedics came, and you kept saying, I don't want to go to the hospital, and they said, we've got some virus, you should probably see a doctor. And so they left, and then the next day I took you to the Siskiyou Clinic. And we had to go through the COVID test several times, and then we did sort of a video, or whatever they call it, where you were talking to the doctor on the screen.
From here at home, or
no, we were sitting in the parking lot of the clinic.
Oh, wow.
I couldn't take you in, and you didn't. I don't know if you remember talking to the doctor at all.
Not. And they brought one of those little portable screens.
And that was
I
sitting
sort of
there.
now you mention, I vaguely remember. It was
right.
Yeah. He was bald or something?
Yeah,
okay.
Right. So they said, well, since we had the negative COVID test, we went straight down to the Siskiyou Clinic in Grants Pass. And I didn't remember the name of the doctor you talked to. And of course, they have a walk-in clinic, and then I guess they have a regular clinic where if you have an appointment, I'm not sure because we don't go to that one. But we walked in, and you were walking with a cane, and I was really afraid you were going to collapse because you just seemed so weak. And I've read about the expression glassy-eyed many times, but I finally saw it because just the way you were looking at me, and you were focused on me, but you didn't seem like you were really there. So, and your eyes seemed kind of glassy. I mean, I can understand the term now, seeing it. So they saw you immediately, and they heard your AFib, and they couldn't get an oxygen reading on you, and they said, I know you don't want to hear this, but you're going straight to the emergency room. And I said, he can't sit in a hospital emergency room for 5 or 6 hours waiting for them to see him. He's too sick. And they said, oh, no. We'll call ahead, because when it's AFib, they're going to want to see him right away, and we're not getting an oxygen reading, so you really need to go right now. So I drove straight over there, and I don't think we were there 10 minutes before they had you hooked up to an EKG, and then came in and talked to us and did a chest X-ray while you were in the bed. I don't know if you remember.
I don't
that.
remember that. No.
And then she came in and she said, she was the emergency room doctor, and she said, we think you might have Legionnaires, and we looked at each other like, oh, that's crazy. How in the world could you get that? That doesn't make any sense at all. And we didn't say that in front of her, but I just thought, well, that's just nuts, So
yeah, we weren't in any hotel or on any ship or anything.
That's exactly what we
Enclosed
said. We haven't
space,
been
and that's
any
what we had
place.
heard of about this disease.
Yeah. So they admitted you immediately, and we went up, and you met Dr. Alex, and they, did the little, whatever they call it, where they put the
Oxygen.
but yes, it's not the same thing as the mask over the face.
Right,
But
so
it's like the first step.
I do
oxygen.
remember, and I thought it was your voice saying, breathe in through your nose and out through your mouth. So that must have been where that came from, was when I had that thing, so they wanted me to breathe.
Well, because you were also kind of panting then, because you weren't getting enough oxygen, and I think people pant when they're trying to get oxygen, and so they were saying to you, breathe in through the nose, out through the mouth, that sort of thing. So you were there that day and that afternoon, and Nathan was there, and so you had pneumonia. Whether we didn't know what kind, that was established. And so I went home about 7 o'clock and came back the next day, and your fever was getting worse. It was obvious. They had you hooked up to enough monitors that I could see what your fever was, and I could see what your pulse was, and I could see what your blood pressure was doing, and all of that was bothering me quite a bit.
Yeah,
so,
what was the fever?
I think you were about 102 then.
102, okay, which is fairly high for me since I'm normally 96.8.
They said anything over 100 was something that they considered a fever.
Okay.
Which, you're right, if you usually run lower, then it would seem
even worse.
It was even worse, right? So when I left, I remember trying to feed you. They brought lunch in, and it was mashed potatoes and gravy and turkey and cranberries and a salad, and you kept trying to get me to eat, because I guess you didn't want to waste the food, and I kept saying, no, have another bite, but you got down almost nothing. And when I left that night, you were looking, I could tell your fever was higher, and you were sweating, and you weren't feeling good at all. So I got a phone call about 7 o'clock the next morning from Dr. Alex that they had to put you on a ventilator, that it was really critical that you go on a ventilator, because they had gone to the mask that night, the mask over your face, and you still weren't getting enough oxygen. And of course they'd started giving you antibiotics, but they had to do it broad spectrum, because they didn't know exactly what you had. They thought it might be something, but until they knew. So so you just weren't responding. And so when I dropped everything, I raced down there, and Nathan was there, and you were coming out of the paralytic, because they have to give you something that paralyzes you while they put that tube down your throat. And there was blood in the tube, and I was real concerned about whether your lungs were bleeding, like whether they punctured it. No, we didn't puncture a lung, but it's traumatic to get it down the throat and into the lung, and that's the only reason there's a little bit of blood. Don't worry about it. But you didn't know we were there. They had you sedated.
Yeah, I don't.
You had no
I
idea
had
that
zero
we were there.
recollection of any of that.
So you went into the hospital on Monday, the 12th, and at Wednesday, the 14th, is when they put you on the ventilator, and you were on it for 11 days. And
wow.
I saw several times, I saw your blood pressure go up to over 180. I saw your heart rate. No, I saw your blood pressure go up to 200. I saw your heart rate go up to 180, and I was really freaking out, because I know what your blood pressure should be. And I know that your heart should never do that. And it was really hard. And they said, he's not going to remember this. They won't remember this, and it's more traumatic for the family seeing them like this. But he's not going to remember any of this, so don't worry about that. But you were so sick. And so they had managed to collect enough of your coughing stuff up to get it down to the lab to be analyzed. But it takes several days, and it turns out, because they have to grow a culture, just like you see
in
in
a
high
petri
school.
dish or something.
In a petri dish. They don't just look at it immediately under, they couldn't just look at that in a microscope. They had to put it in a petri dish. They had to wait for a culture. So the first week there was one doctor, the second week, like Sunday, I guess the new doctor came in, and she wanted to go down, and I can't remember the name of it, but it's when they put a little video camera basically down your throat into your lungs, and they start and then she said,
You can snip a little sample.
yeah, and she said what they did, they then irrigate it with saline, and then they would vacuum it back up, and they got some good chunks, is what she said, some good chunks, which was really disturbing. And
Yeah.
and they had shown us, they had come in and they had shown us your X-rays, or no, it wasn't the X-ray, it was that's like the sonogram, right?
Okay.
Like you'd see a baby in the
Right, it's probably a sonogram, yeah.
It was a sonogram.
I've done
And
had
this
that before.
lung was 3/4 full, and this one was 1/4 full, and then the next time they did it, this one was half full. So your lungs were really full of a bunch of poison. It was killing you. And if they hadn't been so great at Asante, they saved your life. There's no question about it. They were fabulous. They were in there every half hour. Using a swab for your mouth to make sure no bacteria could get down into your lungs. That was a big fear.
Right.
Fresh bacteria to create a new problem. Stuff for your eyes to keep your eyes from being too dry, and constantly shifting you and putting you in. I've never seen, at one point there were at least 8, everything that was going through, that was coming into your system through the IVs, went through a little machine that would then tell them how much was there and when it was going to start to run out, that sort of thing. At one point, 8 of those were going.
Oh my god.
And then your hands were swollen. This is over several days, and your forearms were so swollen that they decided that they were going to have to go into your neck. And so the surgeon came in and got the IV into your neck.
Wow.
Because that's your biggest, I guess it's your biggest vein. So it was this side, it was your right side.
Mm-hmm.
And then they were able to do a number of things through here so that they could take the stress off of your arms, because the veins in your arms could only handle so much because they were having to hydrate you, plus medicine for your AFib and medicine for your blood pressure, and they were feeding you through a tube into your stomach, which was separate. But there were just so many different things that they had to do. They had to make sure that your blood stayed thin enough, because she said, people can get blood clots in their legs. Well, you could have had a blood clot just
easily,
because you needed needed
Right.
blood thinners for years. So it could have been a stroke, it could have been a heart attack, and it was really terrible. So every day we'd drive. Nathan and I started taking turns. So he would be there in the morning, we'd meet around lunch, and then I would stay as late as I could. And they were wonderful. They were really wonderful. They had to take care of a very nervous wife, and they explained a lot of stuff, and they were awesome. They really were, the nurses and the doctors. So but you were very restless. You would work your way off. They'd straighten you up in the bed, and then pretty soon you'd be diagonal with your left leg hanging down, and then they'd put your leg up, and you were, anytime they would reduce your sedation, you were like this, because they had you tied down trying to get out of the bed. Trying to get out of the bed, and your legs going up and down, and you were running, even with all the antibiotics, you were still running such a fever. So they had a fan going for several days in a row, and then they decided they needed like an ice blanket. And so they put this thing on you, and I guess just like we all know what heating pads are like, right? Well, this had a little machine. I put my hand on it. It was like I'd stuck my hand in ice water. I could not believe how cold it was, at least on the outside. And of course, the other side was on you, and they had it from your chin to your knees, just trying to keep that fever down, because they didn't want to pump you full of. You had enough stuff in you. And my impression was they didn't want to. They were giving you what they could. They couldn't give you any more, but
anything else to lower the fever.
Keep your fever down. So that was something. And then close to the end, we came in. There was a nurse I really liked named Shannon. And the nurses were constantly turning over, so you might see one, and then you wouldn't see him for 3 days, or maybe never again. And so I came in once, and you basically had a loincloth, and that's all you had. Was she had a towel decoratively draped just where you needed it, and the rest of you were completely naked because she was trying to keep you cool. We had taken the ice blanket off, and they were trying to keep you cool. She goes, well, I'm taking care of his modesty. He's got his loincloth. Poor guy. It was just, I just couldn't believe what you were going through. But Wesley flew in, and Wesley was there for a week, and the doctors and nurses are more aware of stuff. So when Wesley was there, the doctor said to the nurse, well, he tracked you coming in because the nurse had walked in. So they were aware that you were aware of people coming in and out, even if you couldn't respond to any of us.
Yeah.
And then Wesley was talking, and they said, yeah, he's paying attention to the new voice over there. So you were probably aware that Wesley was there. So we always talked to you. Nathan would always say, hi, Dad, bye, Dad. And I would talk, and just because I noticed they always did. I thought that was really great because they don't know how much you know when you're under that.
Yeah.
So it's always, hi, Rod, I'm the respiratory therapist, and I'm going to do this, or hi, Rod, I'm going to do that. They always told you what they were doing.
Nice. I don't remember it too much.
You wouldn't remember any of it.
I don't remember any of it.
So sedated.
Yeah.
But they wanted to take you they wanted to take the ventilator out. You were starting to get better. But every time they would reduce your sedation, because it's at some point or some level you're aware that there's this thing in your throat and you're not breathing on your own. So at some point, as soon as they would reduce the sedation, you would start fighting it, and your blood pressure would skyrocket and your heart rate would skyrocket. So what they had to do was find something that they could give you that would relax, that they could get you off of the main sedation but relax you enough to get it out. So I don't know how long it takes to get the ventilator out, probably only 10 minutes, but I guess it can be really traumatic for the patient. So I wasn't there when they did it, but Nathan called and said, yeah, they just took Dad off of the ventilator. That was a Sunday, and he's talking. That's what they said. Nathan said he's talking. Because they had told us you might not remember anything. You might not even know who your family members were because there's a residual of these drugs in your system for a while. So,
well, I remembered who you guys were.
You did. You knew who we were. Yeah. Right. You did. So that was a great day. Boy, there was a lot of smiling that day they took the ventilator. That was a Sunday, and then Wesley had to go back on Monday, but we were just there the whole time talking. Or we talked around you. We brought your music in.
Yeah, I kind of remember that. They moved me upstairs to a different room, didn't they, at that point?
No, you were there for a few more days. They moved you upstairs on Tuesday, so they took it out Sunday morning, and you were there all day Sunday, all day Monday, and then Tuesday around noon they took you upstairs.
Okay.
Right.
So that's probably when I was having my visions that, the Indians chanting and stuff like that. Was when I was in that room, but not on the ventilator.
Probably.
Yeah.
Well, we don't know. I mean, you were sedated. We all dream normally, so you might have been having a whole series of dreams, right? We won't know when unless you wake up and remember a dream right away. You don't know. We don't know what dreams we have. At least I hardly ever remember dreams.
I had a real strong sense that I had been in that room before. That this wasn't the first time I was in the hospital. That I was back there again in the exact same room and everything. It's kind of strange.
Well, it was the first time you'd been in that room, but maybe it's because you partially came out of sedation and then went back in. I mean, maybe it was that kind of stuff where you were semi-aware.
Right.
But I would talk to you, and your eyes would be open. And of course, you have to admit, I kept thinking about anytime I've had dental work, and you've got your jaw open for 3 hours for a root canal, and your jaw hurts. You know how it just hurts. Your mouth had been like this, with this huge thing in it for 11 days. I kept thinking, oh my God, his jaw, he won't be able to open or close his mouth. And you try and focus, you'd just be like this, kind of looking at us, but you couldn't really see us. But I'm sure I think you knew we were there, at least to the point you could hear voices. So.
Yeah. Well, I knew when you weren't there because I felt kind of uncomfortable and scared at night.
I bet.
It was dark in that room.
Well, even when you come out of this anesthetic, you're woken up constantly. They're coming in every 2 hours to take your blood. They're coming in every couple of hours of course, they're changing the medication and they're checking the monitors. And, monitors start to buzz when they go off, right? Because things aren't
right.
Right. And So anytime, I'd jump up and I'd go see which monitor was on, and I was always looking at them. It was better not to have understood the monitors. It would have been better to be ignorant, frankly, because it was really scary. It was terrible. It was terrible because I didn't know. At one point, we knew that you were going to survive, right? Because you'd gotten past, you were getting better. But boy, those first few days, I wasn't sure that you were going to survive at all.
Wow.
Because it was just terrible. That was a terrible pneumonia. I guess it's one of the worst.
Yeah, and I never even saw it coming. I mean, I didn't even have a runny nose.
Yeah. So actually, before the culture came back, where the doctor had gone down with the tube, or the camera, the original culture that they'd started growing, because you'd cough stuff up, came back, and they said it is Legionnaires. Now we can be real specific in our antibodies instead of doing a broad spectrum. Since we know what it is, we're going to go straight after that. So anyway, then you went upstairs, and you were much more, obviously you were aware there, but you were so weak, and that's one of the things I think that really got me was your nose is dripping, and you can't bring your fingers together like this to get a Kleenex out of the box.
Yeah, I remember that.
Yeah.
I couldn't find my nose with the Kleenex.
And then when you did, you'd be bumping into your chin. You'd be bumping like this. But
right.
And so when they say, okay, here's the button, press this button if you need the nurse. Well, you couldn't even make the TV go on or off. You couldn't make the sound go up or down, and so you couldn't. Those first few days, you couldn't focus on the button to press the button to try and get help. So it was. Your hands were like this, and she said this is what happens when you're like 12 days. We're so used to using our fingers, so
right.
it took a while for you to be able to get that coordination back. It's just amazing to think that somebody couldn't pick up a Kleenex and use it, because you always pull-ups and everything, and you can't even use a Kleenex. So
it's amazing.
It was very scary. So you want to tell me about some of your some of the things you thought were going on besides the Indian chanting and
Oh, well, I think I already said that in the other interview that Nathan did with me, but
okay.
Yeah.
Well, my favorite was the nurses had been having a party the night before, and you couldn't sleep, and there were 5 empty bottles of vodka in your trash barrel, and you were just sure that they had a party and left their vodka bottles in your trash barrel. I kept saying, honey, I don't think that I don't think they would endanger their patients that way. I don't think they would risk their job that way. But you told several people about it. You were just so sure it happened.
It seemed so real to me.
And what I loved best was
tell reality
when you told 2 of the nurses about what the other nurses had done. One of them looked at the other and said, "I need to start working on the night shift," which I thought was great. So they never told you that what you were thinking was crazy, which I did.
Yeah,
I let you know. No,
you were there
happened,
to straighten me out.
Yeah, you were. They don't want to disturb people that way and make them think that there's something wrong with them, because it takes a while for all that stuff to get out of your system.
Yeah, apparently, because I was convinced my feet had been amputated.
That was an interesting conversation.
Yeah. And they actually hoisted me out of the bed, put me in a chair, and then I said, well, they said they were going to the therapist, they're going to do walking therapy in a few days or whatever. And I said, well, I can't walk. They cut my feet off. And then they looked down at my feet and the socks, and then they said, well, why don't you take that sock off? You'll see. It's a hoof or something.
Oh, you thought you had hoofs. They transplanted hoofs. Oh, there's a bizarre thing.
Yeah. Oh, it was from human tissue from a cousin, a remote cousin of mine or something, that was a genetic match. I mean, I had all these ideas that seemed as real as like me sitting next to you, to me.
I do remember you were still in the critical care unit, so it must have been the day after they took the ventilator out when I came in, and you said, they had to they had to amputate my leg, and I'm like, no, they didn't, honey. I start touching her, see, both of your legs are here. They did not amputate.
So I just moved it down to my feet.
You thought there was some sort of a magic door. There was a sign like, what was the sign about?
Call, don't fall.
Yeah, and you thought there was some sort of magic
door behind that.
A door behind there, which there wasn't.
Or if they wheeled me into that room, I was as good as dead. They were going to do some kind of open heart surgery on me or something that I probably wouldn't survive. That's what I was thinking.
Well, I was really afraid that you might have a heart attack with all this going, and then it would just be one more complication, wouldn't it?
Yeah.
One more critical thing happening
Yeah.
to you if you'd had a stroke or you'd had a heart attack. And so, you know, for years you've been on the Coumadin, and you know you're supposed to read between a 2 or a 3, and I'd say, well, what's his blood? You know, what's his blood level? And they'd say it's a 1.6, and I'd say, well, that's too low. It's supposed to be, or you know, it should be over 2. And she'd say we're giving him a regular.
Another.
Yeah, they were using a different drug, and they were giving you a regulation dose or something like that. So they had to reassure me over and over again. I mean, I could see they were taking great care of you, but I was afraid for you. So
Yeah.
I had lots of questions, and there's lots of things I was trying to understand. And they would talk shop, but I was always listening when they were talking shop.
Yeah. Well, it's good,
Paying
important to
attention.
have an advocate there. I mean, Nathan was my advocate in the mornings, and then you were there in the afternoons, and that was great.
Wesley was there for 3 or 4 years.
Yeah, Wesley. I don't remember much about Wesley. I
No.
remember talking to him once,
Yeah.
but and asking him about
Mhm.
you know his duty station and
Mhm.
how much longer. You know, I had forgotten how much longer he had me at the Great Lakes station and everything. But yeah, it was a very interesting, weird experience. I feel pretty normal now, except I still can't do my pull-ups, although I can get about this far now. And I'm still get chilled very easily. I just can't.
Yeah.
Yeah. I lost a lot of weight. I lost 20 pounds, I think.
And you've gained about
I've gained
6.
back 15 or 16.
Mhm.
So it's pretty good, but I still, you know, we've had a lot of cold weather recently.
Yeah, you're smack winter. Yeah.
I'm getting kind of chilled working out in the cold. But that's